Hello everyone, welcome to Female Nature. I am your host, Victoria Chinenye Okoli. Today we will be discussing the symptoms of perimenopause and menopause. On the last episode, we tried to understand a bit more of the difference when we are referring to menopause in general, the different stages of menopause. So today, let's look at the symptoms and try to understand them more, and so that when people are feeling anything that they are feeling, they will understand the reason why. Okay, let's look at the first one, brittle nails. Brittle nails is when the nails start to be not as strong as they used to be, and they tend to break easily. And sometimes people notice that there are ridges on their nails, and the nails are also dry. This is in relation to perimenopause, and it carries on up until the menopause years and postmenopause as well. Number two, burning mouth. This is when people feel maybe they get blood spots on inside their mouth that they didn't used to get before, and this might be sometimes when they eat something that is let's say it is spicy or it is strong, maybe like lemon, or if they eat something that is a bit more salty, but these things that they used to eat before without any effect. But for perimenopause and menopause, people tend to see that, oh, their mouth is burning easily, or that they're getting um, blood spots inside their mouth. The next one is a crawly skin. Crawly skin is when people feel that there is something uh, crawling on their skin. They like if there's an ant or something crawling on their skin, and the natural tendency would be to maybe to scratch the area or to touch it to clear whatever is there, and you find out that there is nothing there. It's crawly skin that um, it is being termed. And dental issues appear as well as part of perimenopause. Sensitive gums, the teeth will be cracking, and different issues in relation to the 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 teeth. So people need to keep an eye and to understand that in as much as they're doing the best they can, these issues are likely to be perimenopausal symptoms which carry on up until the menopause years and postmenopause as well. So increased dental hygiene is very necessary, and then getting dental checks regularly every year or every 6 months will be helpful. And dizziness is one of the symptoms of perimenopause as well. People tend to feel so lightheaded even when they haven't done anything major that should cause the dizziness, and even when they've done their blood work and their hemoglobin is normal. But this is part of the perimenopause symptoms that people need to be aware of. And dry eyes as well. Yeah, dry eyes, when people feel okay, there's something in their eyes that they keep touching their eyes to remove whatever it is. It might be like hair, they think it might be hair or something got into their eyes, but actually there is nothing there. I think it's just the eyes being dry. So people need to be aware of that as well. And when it comes to dryness, we'll talk about dry skin generally, and dry private parts, which is dry vagina. The ears can start to ache, or people might be hearing ringing in their ears. Most of the time, it's not just due to a perimenopause or menopause, so it is good for people to get it checked just to make sure that there is nothing else of concern, so they can speak with their doctor. Changes in food tolerance. The things that people used to tolerate before, they will notice that after a certain age, maybe from their early 40s, they are not able to tolerate them anymore, and they might be feeling bloated, or they might, if they eat certain food that they used to eat before without any problem, now if they eat the same food, they will be feeling bloated, uh, they may be having acid reflux or indigestion. These are also in relation to the reduced estrogen in the body, which is linked to perimenopause and menopause in general. Brain fog, being forgetful, is one major aspect of perimenopause and menopause. A lot of women are feeling this particular symptom. Sometimes they will go into a room to get something, and all of a sudden, just within a split second, they've forgotten what they've gone into the room to do, or they've gone into the kitchen to do something, they've forgotten what they've gone into the kitchen to do, or they want to say something, the word just escapes them like that. So just all of a sudden, they don't remember what they were about to say. And again, the low level of estrogen in the body affects the heart as well. This is why it is important when people start to feel all these symptoms for them to check with their doctor so that they will do all the necessary tests to make sure that everything is functioning properly. The heart will start to beat fast, or it will flutter as if, when the feather, like a bird feather, is fluttering. It will flutter like that, quick, 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 and then it will stop again for no reason. It's not like the person has been exercising, or they've been walking, or they're doing anything major, but the heart will just palpitate like that or flutter. And hot and cold flushes, these are major symptoms of perimenopause and menopause as well. A lot of women are getting, or do get, hot flushes and cold flushes. One moment they are feeling so hot they want to take out all their clothes, and the next moment, oh, they have this chill all over their body that they want to have additional layers on as well. It keeps changing like that, on and off, on and off, on and off. And even during the day or during the night, it can be anytime. So that's part of the symptoms of perimenopause, and continues up until the menopause stage. Inability to dream and remember dreams. This can be frustrating for people, for women who are used to, say, in their younger years, they used to dream every night, they used to remember their dreams. Then gradually, they wake up in the morning, their dream of the previous night escapes them, they don't remember, or it might be a shadow. They'll be thinking, oh, they dreamt about this or dreamt about that, but it will all be disjointed. They can't really link all the clips, all the bits that they saw in their dream up. They can't link them up accurately as before. It doesn't happen all every night. Some nights they will still dream normal, but it can be frustrating for people who are used to dreaming, and they always like to dream anyway, to see things in their dream, and all of a sudden that ability is reduced significantly. And increase them body odor as well, due to the sweating. Sometimes the hot flushes, the frequent sweating, which is a perspiration, it increases the blood odor. So it will be helpful for people to keep an eye and look for solutions, and speak with their doctor if they want to. Yeah. um and that increase the hot flushes is also linked to the increased sweating at night, even though that they may not really be feeling so cold at night, but they will be feeling a lot hotter at night. They're sweating more, and you find out that sometimes even when it's cold at night, a woman will want to put the fan on. Yeah, so which can be a bit frustrating if they have other people in their rooms, like their husbands or their boyfriends or their partner. So that can be a bit frustrating anyway. But it is useful. It is helpful for women to have a fan handy by their bedside at night. Yeah, to cool the temperature and to help them sleep. Irregular periods, this symptom is major for a lot of women, especially from the earlier years of, say, in their early 40s. This is one crucial symptom to let people know that they are in the perimenopause stage. The period that used to be regular before will gradually start to change in its format. It will be longer or shorter. It will come maybe this week, and instead of for the next 4 weeks for it to come or so, all of a sudden after 2 weeks, the woman will see her period again. So it's just erratic. It's here and there. It is so heavy sometimes, or it is lighter other times. And all these changes are not the way the woman used to see her period. So it is important for people to bear in mind that this is relating to um, perimenopause. And the other thing is joint and muscle pain and stiffness. It is important also for people to know that this is in relation to the changes in the level of estrogen in the body. And less sex drive is also part of it. They are not enthusiastic as they used to be when in previous years. Yeah. And migraine and or tension headache is also part of the perimenopause symptoms, and sometimes it will be associated with nausea, people feeling like vomiting. Yeah, so if people are having migraine, I think they need to speak. If it's not manageable, if they cannot manage it with over-the-counter medication like paracetamol or ibuprofen, it is important that they speak with their GP to run other tests for them. Mood swings. This perimenopause symptom is also worrying for a lot of women. You find out that sometimes some women just get so emotional about little things, or most people they just get so irritable. A little thing they get upset. A little thing that is not very important will really upset them. This is in relation to changes in their mood. Skin changes is also part of it. The skin will lose its elasticity, and cellulite will start appearing, especially on the buttocks and the thighs. Yeah, the skin will be folding. That's what the cellulite is, and on the arms as well. Sleeping problems, this is important and very it affects a lot of women. A lot of women are not able to sleep. You even in your circle of friends or workplaces, you tend to come across women talking about they can't sleep, and some people don't go to bed, or they can, even if they go to bed early, it takes them a long time to fall asleep. And even if they fall asleep, they cannot retain that state. They cannot keep sleepy for several hours. They will be up, and they will wake up and fall again, fall asleep again, wake up. And when there is interruption in the sleeping pattern like that, it affects the brain, and that increases the brain fog, the forgetfulness, because the brain hasn't really rested properly the previous night. And then thinning hair, when people find out that their hair is now thinner than before, whatever they're doing, even if they're doing the same thing, looking after their hair, this is age related and is perimenopause and menopause related as well. This is all part of changes in the body. So people can find ways to help themselves, but it's just natural for people to know that for some people, the hair will start to get thinner, not as strong as it used to be. Urinary leakage and frequent urinary tract infection is also part of the symptoms. Sometimes people find that maybe they're not really feeling like using the loo, but as soon as they put the key on the door, which normally is termed keyhole urinary incontinence. As soon as they put the key to the door to open the door to go into the house, they are rushing. All of a sudden, they are rushing to use the loo. And again, even if they are not rushing, even if it's not keyhole, like they are coming back, they've been out, they are coming back to their home. Sometimes when they're in the house, they cannot retain, or they are just out. They cannot keep urine for longer. They cannot endure it for as long as they used to. Maybe the person is just traveling, they've got an hour to get to their destination or something like that. Before, they will be able to bear it until they get there, and even longer. But when a perimenopause is kicking in, people will find that, oh, they can't really bear it, and then there's a bit of urgency, or the urine is leaking gradually. Weight gain is big. This affects a lot of women. They'll start to put on weight even when they're not eating much, really. They're eating very little, but they are struggling to shed the weight, especially on the upper arms. So the hand gets bigger. They find that they need to change their clothes size, maybe one size up or something like that, to feel more comfortable in their clothing. This is all relating to a perimenopause, and it goes on up until postmenopause years. Some of these symptoms, they subside over the years. Once the period stops, once the woman goes into menopause proper, which we discussed on the previous episode, the 12 months of no period. Once the woman goes into the proper menopause, post-menopause, all these symptoms, if they're feeling them, or most of these symptoms, they tend to subside, because by then the body is used to its new nature. And we need to bear in mind that not all these symptoms affect every woman, because everybody is different. It might be just one or two that people feel. And what I want to mention to you about a nosebleed is, you may notice, some people may notice that when they are having nosebleed, it tends to be from the same side of the nostril. It's only one side of the nose that they tend to bleed from, and they can't explain the the reason for it, or what triggered the nosebleed. But like 99% of the time when they're having nosebleed, it tends to be the same side of the nose that they're bleeding from. So it is important for people to keep an eye on their general health and well-being, and people need to understand that all these changes in the body are natural. They are linked to the reduction in the production of estrogen in the body. So I suggest that people see their doctors if they are worried, so that the doctors can run a full test for them to make sure that there is nothing wrong, that is just perimenopause, um, menopause symptoms that they are going through. And it is very important for people for their body to relax. Everybody needs to be happy. Try them as much as they can to be happy and to have a peace of mind, because this is important to help the body to be stable. So on the next episode, we'll be looking at self-help tips, how women can actually help themselves to overcome most of these symptoms. Until the next time, take care of yourselves. Bye bye.